potentially the rest of mankind
will have this mRNA.
They just infected the rest of mankind history. They just altered all of mankind's history.
Yep.
Think about that. Yep. This mRNA, it passes down. These blueprints are altered forever. And every single human after this shot was given out will have this altered DNA to them.
Yep. Welcome back to another episode of the Burning Issues podcast. Today's episode is long awaited. This is probably going to be the peak, the climax of the series.
Bovid.
Bovid. Today we are talking about the clot shot.
I like that.
Some call it.
I like
Fauci
that.
Flu. Whatever you want to call it. But we are here. As you can see, we've done lots of research. We have lots of very good scientific studies because we know we have some haters in the comment section saying, hey, turn me up in the headphones. Turn me up in the headphones right now. We have lots of people in the comment section saying, oh, where are your studies? All right. Let me give you a little teaser. Science, Public Health, and Policy in the Law. Scientific study. How many pages is this? 50-something pages. Wow. National Reviews, Drug Discovery. We got all types of strategies to reduce the risk of mRNA drug and vaccine toxicity. Wow. Come on, bro. We not playing games with y'all no more. We got PhDs. We got Dr. Peter McCullough. We got Robert Malone. We have all the who's who in the vaccine industry. So, yeah, where you want to start off here?
Whew. There's a lot, man. Yeah, Mike's having a little... Mike suffers from ED.
No, we got
it. I don't know, James. We have that's so overwhelming. Where do we even start?
Let's start off on the whole how it was developed, the timeline, and everything else. Then we get into the boom, 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 boom. Okay. Because I have right here. Let me just front run you a little bit. The first doses of the Bovid vaccine were administered 11 months after the identification of the SARS-CoV-2 gene sequence. Now,
that's outrageous.
This, according to this study, which represented the fastest vaccine development in history.
Not the fastest mRNA vaccine. This is
history.
Again, I'm going to say this. Not only was this the fastest vaccine produced in history, before this, no mRNA vaccine has ever been mass distributed before this. So, new technology, and it was the fastest vaccine ever to be distributed.
Was not properly tested.
And let me, before we get into this, again, we said this before earlier in this COVID-19 series, but we are not against vaccinated people.
No,
we feel like they were blinded and they were pressured, absolutely pressured and blinded. And if you didn't know where to get the right sources from, then it was very easy
to fall victim.
Yes. So we have no problem with vaccinated people. We aren't anti-vaxxers. But this COVID-18 shot,
it's not a vaccine.
The clot shot.
Clot shot.
This was no joke. This was a direct attack on humans across the globe.
This was not a vaccine. Look, if you want to mention from the last episode, you had that Chinese virologist. Mm-hmm. What's his name? Yeah. Go ahead and give that quote real quick before we jump into this.
Let me find it.
Go ahead and give that quote real quick. He said, and quote, the Bovid shot is not a vaccine. And he said it was a bioweapon.
Let me see. Chinese virologist who fled to the U.S. claimed COVID-19 was engineered as a bioweapon.
Boom. Boom.
That's their own folks.
That's his thesis statement right there.
That's their own folks.
Let's get into the body of the people.
Mm-hmm. All right, James. I got some. I mean, I can run through it.
Yeah, run through that real quick.
I can run through the COVID, and then I have the normal vaccine on here too. Which one you want me to cover first? Which timeline? Normal vaccine?
No, let's go normal first. Okay. Give him that, and then come right behind it with the COVID.
I'm gonna just give y'all. Let's see. I got so much here. We had to find our notes real quick. We got so much information here.
Yeah, it's getting all mixed up. But normal vaccine development typically takes 10 to 15 years from the initial research to widespread distribution. Now, the process is first, exploration phase. 2 to 5 years. Research identified potential antigens that could trigger an immune response. The preclinical stage. Laboratory and animal studies assess safety and immune response potential. 3. 6 to 8 years of the clinical trials, conducted in 3 phases. Phase 1, 1 month to a year. Small group testing for safety and dosage. Phase 2, 1 to 2 years. Hundreds of participants to evaluate effectiveness and side effects. Phase 3, thousands of participants for large-scale efficacy and safety testing. 4. Regulatory review and approval. 1 to 2 years. Health agencies such as the FDA, EMA, review data before granting approval. And 5. Manufacturing and distribution, which is ongoing, scaling up production and logistics for global distributions. So that process takes in total 10 to 15 years. And I just said this came out in 11 months. Overhead cam. 11 months. The fastest vaccine development in history.
Yep. And you want me to run through that? You want me to run through?
Run it through, see how they did it and what they missed out on. We can even go side by side.
So COVID. Preclinical research, 3 months. Skip many animal testing stages or ran them in parallel with human trials. That makes sense. That makes tons of sense right there. Use mRNA technology, which had never been used in approval in a vaccine before. Phase 1 clinicals, 1 to 2 months. First human trials conducted at record speed. Then we got phase 2 clinical trials. Mid-sized testing groups, usually 100 to 1,000 participants, focused on short-term immune response, but lacked long-term safety monitoring because it was done in less than a year. How can you have long-term? Phase 3 clinical trials, 4 to 5 months. Tens of thousands of people tested but monitored for only a few months. No long-term follow-up. And trials were unblindly early, meaning long-term placebo comparisons were lost. Then emergency use authorization, December 2020. Approved within days.
Right. That's a warp speed stuff.
Yep. Who approved within days/weeks instead of years. Mass production global rollout immediate. And listen to this. Governments pre-purchase millions of doses before its approval. So, if all these governments bought these vaccines and it didn't get approved, they thought, you think that's going to let slide? We just spent millions of dollars on these vaccines. Oh, well, we can't give them out.
They knew it was going through.
Yeah.
They knew it was going through.
So we got normal vaccines for 10 to 15 years. And then we have an mRNA experimental vaccine.
Yep.
Less than a year.
Make
that make sense. And people, the media made it sound like, oh, this is good, mRNA is good, all this stuff. You said in the last episode, the founder of mRNA said he would not let his kids take this vaccine.
Oh, yeah. Speaking of that, let me find that. Here it is. Dr. Robert Malone, overhead camp. Dr. Robert Malone, who helped invent mRNA technology. He's also known as the godfather of mRNA, but, he probably has some partners. Warns that scientists are downplaying the risk of Moderna COVID-19 vaccine, but they're all mRNA. Some people say that just because they didn't get hit, that it wasn't a bioweapon. No, some doses in certain areas, some doses weren't actual doses. Some were saline and everything. But anyway, per the Epoch Times, several health officials claim that the spike protein found in the Moderna jab would naturally exit the body when the vaccines are rolled out. However, that proves not to be accurate because it's mRNA. The RNA part goes in your mitochondria. Your mitochondria programs your ribosomes then carries that to the DNA. So if it's in there, it's in there. So it's basically like if you write code for a computer, right? And you write a message of code, it's an error in the body.
Yeah.
Just that simple. The mRNA vaccines have known multiple side effects, including, and quote, heart inflammation, severe allergic shock. Those may stem from hypersensitivity reactions, which can be elicited by LNP mRNA component, but they are most likely triggered by PEG-related lipid nanoparticles, which is the most potentially reactogenic component. According to scientists, polyethanol glycol, or PEG, an ingredient in the Pfizer and Moderna COVID-19 vaccines, is known to cause allergic reactions. Outside scientists are divided over the mechanism behind the heart inflammation, while Pfizer has posited that the LNPs are behind the issue. The scientists said that Moderna COVID vaccine is safe and effective. which is wrong. Now, let's slow our roll here. Let's not jump the gun. Let's really, you can't just try and knock him out first round. You gotta throw some jabs. So look, I got my study right here. Overhead cam. Systematic review of autopsy findings in COVID deaths after COVID-19. All right, so put this up here for a second. Now, as I mentioned, this was the fastest vaccine ever created. And we'll just walk y'all through what they skipped, why they skipped it, and all these different things. So let's just talk about what we are seeing here. So let me get my chart out.
Uh-oh.
Because everybody likes pictures.
Yep. I'll put this picture on screen right now. What you're looking at.
This is the proportion of cases by affected organ. So this big old pie right here, 49% was neurological damage. So I remember when COVID first came out, you see those videos of people in the hospital having seizures. Shaking just uncontrollably. Now, why is that important? That's a neurological issue. Something going on with the brain, the body not getting the signals right.
Here. Put that in the middle. Make sure the overhand cam gets us. Put this in the middle. Let's make sure we got a clear shot right here.
Now, we got 7% was multiple systems.
Yep.
Hematogic. I'm not sure what that is. I think that has to do with blood. Hematogic. Respiratory. Lungs. We had, and on top of that, we had these people going in with the COVID and they're putting on ventilators. So they were really getting double whammy.
No good. No bueno.
Now, we got the cardiovascular system. That's why we saw all those kids. I know you put in the last episode, the sudden death documentary, y'all saw the lady with the paper with nothing on it.
Yes.
Nothing on it.
Yes. And look. While you're talking right now, while we're talking about this, Sudden Death is a great documentary. It can be found free on Rumble. Yep. Highly advise you watch it. It's about all these blood clots. We're going to get to that later. We're going to put some clips in of those blood clots.
Yep. Look like somebody pulling a rubber band out your blood.
It is very unnatural. It looks highly unnatural. It looks like white rubber coming out of these veins. Yep. And they took the shape of the vein. It's gross stuff.
Yeah, we're going to make sure you drop that in the description of this video. Now, cardio. That's why we had all these young kids, because the vaccine affected people who were super active, because the harder your cardiovascular system works, the more these mRNA lipid nanoparticles pump around. So you had 18, 19, 20, 21-year-old people, like athletes. Some people who were in the best shape of their life, dead. Heart attack. Myocarditis.
And that is called, I got it right here. We're linked to rare but serious blood clot disorders known as VITD, vaccine-induced thrombocytopenia and thrombus.
Yeah. So it's just ridiculous. And people say, the COVID vaccine is safe and effective.
Studies suggest that the spike protein mRNA vaccines can trigger inflammation in blood vessels, increasing clot risk.
Yep. So let me go back. Look, we not done here. So, key point, impact point right here. This chart is gonna be on the screen. Y'all, look. This is the great thing about this. So you got all this evidence. You do not look. You do not have to believe me. You can go look this up yourself. Now,
all of this will be in the description. One click away.
Now, let's go in here because I got some points I want to hit on. So. So as far as the vaccines go, all utilize mechanisms that can cause serious adverse events. Most involve the uncontrolled synthesis of the spike glycoprotein as the basis of immunological response. Circulating spike protein is likely the deleterious mechanism through which the COVID vaccines produce adverse effects. Spike protein and or subnets peptide fragments can trigger ACE2. Receptor degradation and destabilization of renin-angiotensin, also known as RAS, resulting in severe thrombosis. Spike proteins activate pallets. Now, what is thrombosis? That is a blood clot that it clots somewhere and it finds its way to someone's brain. The neurotoxic effect of spike proteins may cause or contribute to the post-COVID syndrome, including headache, tinnitus, autonomic dysfunction, and small fiber neuropathy. Now, so we're really seeing what this is, and you just mentioned BITT, huh?
Yes.
So, this is not what James said. This is not Wilson. These are the scientists.
Yep.
In adolescents and young adults diagnosed with post-mRNA vaccine myocarditis, Free spike protein was detected in the blood while vaccinated. Controls had no circulating spike protein. It had been demonstrated that SARS-CoV-2 spike protein mRNA sequences can circulate in the blood for up to 28 days after vaccination.
Look, to build all that, I got it right in front of me. Studies confirm mRNA vaccines increase myocarditis risk, especially in young males 16 to 30. CDC admitted the risk, but continued to push vaccine and boosters. Then we even have in a recent study a court hearing right here. This is going to be in the description. FDA must disclose more COVID-19 vaccine records because with the Pfizer record, they said what's the exact number? 1,200 people died.
Oh, I got
1,200 people died during the Pfizer testing, and they kept it shut.
Look, let's continue walking them through it right here. Through May 31st, 2024, the Vaccine Adverse Reporting System, VAERS, we talked about VAERS on Express Reality, contained 1.6 million adverse events reported associated with the COVID-19 vaccines, including 37,647 deaths, 28,445 myocarditis and pericarditis, and 21,741 heart attacks, including 9,200 thrombotic PINA reports. If COVID-19 vaccinations is indeed a determinant of an alarmingly high number of reported deaths, the implications could be immense, including the complete withdrawal of vaccines from the global market.
Yep. And Pfizer went to. Some reports suggest, we're gonna have to take the word for it, but seeing how Pfizer runs, this is no surprise. Pfizer wanted to keep the trial data sealed for 75 years.
Here.
75 years.
Look, I got right here a table.
Woo!
Now, so let's look at this here. I'm not to blow this up because they can't read it. Now, author, Hodgeberg, year 2023, country, United States, cases, sex. They don't give me sex, but vaccine, Moderna, cause of death, eosinophilia, which is an immunological disease, dead. Okay, Japan, Nasuda, cases 1, age 14, female, Pfizer, MIS. I'm not sure what that means, but dead. 2 days, dead.
Mm-hmm.
Korea, Jeon, 1 case, 19 years old, male, Pfizer, 2 doses, multiple sclerosis, neurological, 182 days, dead.
Yep.
Iposito, Italy, 1 case, 83, male, Pfizer, COVID-19, MIS. Not sure MIS means. We will put that in the description. Germany, 1 case, age 76, male, Pfizer, 2 doses, encephalia and myocarditis, 21 days, dead. And we just go on and on and on and on. I'm talking about, we have people who are in the prime of their life. 37, female, Italy, 2022, 1 doses, VITT, hematological, 24 days, dead. What is this? So, my question to the audience is, when you see all this stuff, what are we thinking? What is going through your mind as we present these facts? Because one thing that is for sure, this thing should have never been for global consumption.
No.
At all.
No.
At all.
Mm-hmm.
Because I'm really not. I had something that mentioned that they did studies on rats or something, but they don't have the same, genealogical makeup as humans. So they
Wait, are you saying a rat is different from a human, James?
Indeed.
That's interesting, James.
Indeed. So that's really just the tip of the iceberg. We only hit one study.
Yep.
One study. Now, we'll mention something about Pfizer and their vaccine. So, which I actually ran into myself. So, Pfizer failed to report deaths. 2 deaths during Pfizer's COVID-19 vaccine trials were not disclosed. The deceased were a 63-year-old woman from Kansas and a 58-year-old woman from Georgia. Both were classified as sudden cardiac death in their internal documents. Deaths were not reported to FDA's Vaccines and Related Biological Products Advisory Committee on December 10, 2020. A 37-day delay in reporting the Kansas woman autopsy, despite it being before the cutoff date.
Yep.
What is that? Sounds like a good old-fashioned cover-up for me. Now, on the same topic, Dr. Chris Farr states such deaths could have halted the trial. FDA usually stops clinical trials for further investigations when such events occur. Analysis of COVID vaccine and booster data found insufficient evidence to justify continued use. Dr. Philip R. Oldfield states warning about mRNA risks were ignored in the earlier pandemic. A new peer-reviewed study in the Journal of American Physicians and Surgeons calls for the moratorium, meaning stop, on mRNA COVID vaccines due to safety and concern of lack of testing.
Mm-hmm. Yeah.
I mean,
it's right there.
It's crystal clear.
Right there.
It's crystal clear. Look, 1,223 deaths were reported within 3 months of the Pfizer-BioNTech vaccine rollout. Thousands of cases were categorized as unknown or not recovered in Pfizer's post-marketing report. What does that mean? What does that mean? Regulatory oversight failed to require proper toxicology and carcinogenity testing. What is that? Look, toxicology studies state were conducted only on Wistar-Han rats instead of standard two-species approach, rodents and non-rodents, like primates. What are we doing?
Skipped. Well. I mean, we already discussed this. They said they were doing animal testing parallel with human testing.
Clinical trials were deficient, failing to measure the amount of variability of spike protein production in individuals. So, I don't know if y'all are following me here, but what I'm seeing is that this not only was it rushed, but experts agree that it should not even have been on market.
Yeah. Now, okay. So we got plenty of data supporting that the vaccines were at the very least not ready for human consumption, right? So let's talk about. Let's just dissect that real quick. So yes, it's a pandemic. We understand it's a pandemic because we're gonna have everybody say, "Oh, it's a pandemic. They didn't have 10 to 15 years to test this." Blah blah blah. But we're talking about the same pandemic. In the first year, it killed 3.3 million deaths, which was a lot. Out of the 85 million cases in the U.S., that's a 3.88 mortality rate. And that affects older people. This vaccine is doing the complete opposite. We saw age 15 to 30-year-old men, young men, died from this vaccine.
Look, I just brought the table.
Yep. So we had a 3.88 mortality rate. Let's push this experimental vaccine. That could have adverse effects and already has adverse effects, and it's only been 4 years. What's down the line? What's down the line? So let's talk about motives here.
Okay.
Is it population control? Is it what could it be, James? What do you think?
I think it has to be the depopulation agenda. Y'all, I don't know if y'all are sure or y'all ever seen the Georgia Guidestones. It's like keep the population under 550 million.
Yep. And, I got a whole section on Gates here. I got a whole section on Bill Gates. So,
hold on. Before we get to Gates, before COVID, there was no such thing as turbo cancer. No such thing as turbo cancer. This thing was coined immediately after the release of the COVID-19 shot. The term turbo cancer is used to describe highly aggressive late-stage cancers that have become more prevalent, particularly among young individuals with no prior family history of cancer. These cancers are often diagnosed at advanced stages, making them difficult to treat. Explain to me, if this was a safe and effective vaccine, why would somebody who had no cancer, no family history, all of a sudden have stage 4 breast cancer, stage 4 thyroid cancer? That means that something in there is causing their body to trip out. It's absolutely ridiculous. And look, like we mentioned before, we're not anti-vax, but this was not a vaccine. Let me.
This was a shot.
Let me. Hold on. Let me find the quote. Doctor said, "This is not a shot. They said this is gene editing therapy. This is not a shot." But essentially, here's what I want to say before we get into Gates. Essentially, what I'm saying is this. We just showed you the experts, laid it out. All of them said this is not safe and or not effective. And we showed you the data. Everything that you need to see. So it's up to you to make a decision. Now, we're not saying that you're a bad person because you got the shot or anything. We know that in that time, the fear was at its height.
Yes.
And they were pushing major propaganda.
And we got multiple companies. We got all these news sources look, we went into fear and propaganda in our first episode and in the lockdown episode. But we got all these initial claims by Fauci, by all these people. Oh, 1 or 2 doses. Because first it was like, you got to get a 2-part shot.
The first and the booster.
Then you got to get the... Well, no, it's 2 parts.
Oh.
Then you have to get a booster after that. And it's like, oh, get a booster. Then every year you have to get a booster. Now every 6 months it's recommended for a booster. They try and pump you full of whatever's in here.
The clot shot.
The clot shot.
Now, before let me just give y'all a little bit more data before we move one more time. Now, I want to note there was a professor. Let's see where he was. North Australian professor. He stated Professor Brightenthorpe warned that such contamination could lead to genomic instability, potentially resulting in cancers, and he's speaking about the COVID vaccine, autoimmune disease, and other severe health issues. He emphasized that the contamination levels were reportedly 145 times the permissible limit, labeling this oversight as a catastrophic failure of public health governance. Now, this is a professor who studies vaccines, who studies viruses, and I have more data for you. There was a significant increase in CTE and AEEs.
Yep.
A CTE, or is it a CTE? It's a cerebral thrombolism, which, in other words, a brain clot.
Brain clot. Okay.
There were 5,137 reported cases of CTEs, and in 36 months following the COVID vaccination, compared to 52 cases for influenza vaccines. So now we're seeing a direct comparison between an actual vaccine, not that it's very effective for the flu, and the COVID gene editing clot shot.
Here, run those numbers again.
It was 5,137 reported cases of CTE, cerebral thrombolism, in 36 months following the COVID-19 vaccination, and compared to the 52 cases for the flu vaccine. How long the flu vaccine been on? Years. And this is what? I don't know. That's more than 10 times this number.
So
overhead shot. More than 10 times that number.
Yep. So we got a vaccine that's been around for years, and it's 52 cases. Then we got a vaccine that's been around for I don't know when this study came out, but let's go worst case scenario. It's been out for 4 years. 4 years, 5,000 reported cases, and that's reported cases.
Right.
Versus the vaccine that's been out for decades has only 52 cases. What does that tell you?
I would like to mention this also. These CTEs were more common in females. Now, if we're going to talk about what was this about, this is definitely in locus control, because there is no generations if there is no female fertility.
I have a whole section due to fertility. I got a whole section due to fertility.
So yeah, now we can get into Gates.
Okay.
So I want to lay that out.
So we got Gates here. Bill Gates. Yes, that guy who made Microsoft. What does he have to do with COVID? So some of you might be asking, some of you might not follow Bill Gates. He's a little weirdo. He wants to stick his $1 billion hands in all the world problems.
Yep.
Farmland. He owns a bunch of farmland, not personal farmland, industrial farmland. Right? And then he's supporting all these vaccines. He gave polio to a bunch of African villages. Polio vaccines to a bunch of African villages, and they all died. What was that? Why do that? So, the Gates Foundation has contributed over $2 billion towards vaccine research and development and distribution. He was a major founder of Gavi, the Vaccine Alliance, which helped distribute COVID-19 vaccines globally. The foundation has financial ties to Pfizer, Moderna, and
AstraZeneca.
Yes, raising concerns about conflict of interest. Do you know about Event 201?
Yep.
So, let me explain. Event 201, it was a pandemic simulation before COVID-19, and it came out months before the outbreak. And you're like, oh, well, that was just a coincidence.
Go ahead.
The Gates Foundation co-sponsored Event 201, a pandemic simulation that earlier predicted a coronavirus outbreak. So not only was it a virus simulation, it was a coronavirus family simulation. That's all you need to know right there. This led many to speculate whether the event was pre-planned or not. So we got this guy who donated billions of dollars to vaccines, and just months before, his foundation
I'm glad you brought that up.
also co-founded Event 201. Let's see. He's supported proposals like ID 2020, a digital identification system. That's a whole nother thing. And so I'm gonna put the clip in of right now of Bill talking about. There's a few clips out there. Bill talking about overpopulation. He thinks the Earth is heavily overpopulated, and I'm gonna let the clip explain for itself what he has to talk about.
In this year's annual letter, Melinda and I take the toughest questions we get asked and give our answers. One that's come up for a long time is, as we make the world healthier, is the population going to get so big that feeding everybody and maintaining the environment is going to be impossible? Here we can see a chart that looks at the total world population over the last several hundred years. And at first glance, this is a bit scary. We go from less than 1 billion in 1800, and then 3, 4, 5, 6, and 7.4 billion where we are today is happening even faster. So Melinda and I wondered whether providing new medicines and keeping children alive, would that create more of a population problem? What we found out is that as health improves, families choose to have less children. And this effect is very, very dramatic. We find that in every country of the world, this is repeated. The population growth goes down as we improve health. So we've taken that chart that shows the global population growth, and we've actually extended it out all the way to 2100. And we can see that instead of continuing, it actually flattens out. Another way to see that is through this rate of population growth. And you can see that in the 60s, that reached a pretty high number, over 2% per year, and it's now come way, way down. Now, 11 billion people, still a lot, but the good news is that the faster we improve health, the faster family size goes down, and so we can feel great about saving those lives.
Yep.
So, after watching that clip, he goes, oh, the Earth is way overpopulated, which if you do research, it's not. We're actually underpopulated for the amount of resources we have available. Significantly underpopulated, in fact. And he's like, yeah, so we have an overpopulation problem, and the only way to fix it is by vaccines and healthcare.
Yep.
What sense does that make?
Don't make sense.
That doesn't make sense. He says, oh, well, if people are healthier, instead of having, 2 to 5 kids, they'll have less kids because they're healthier.
That makes no sense.
This isn't the 1700s, Bill.
Right.
People don't at least in a lot of first and third world countries, there has to be a really poor country for people to have that mindset.
Yeah.
Most of the population in the world comes from first world countries. Or developed countries, because third world countries don't necessarily mean they're underdeveloped. That's a Cold War term. Anyway, so no one has that mindset, or the people who are having kids don't have that mindset. In a lot of developed countries, they don't have that mindset of, oh, let's have more kids in case a few die.
Right.
Mass majority of the population does not have that mindset. So I have no idea what Bill is talking about. So he's pushing this agenda to make vaccines better to depopulate the planet. That makes no sense. That makes no sense. So we have this guy, this billionaire, who funded the vaccines. Not to mention Pfizer made a ton of money off of the vaccines because the government paid for the vaccines and distributed. So the Pfizer and all these other companies were just taking the profit. And if something goes south, they're protected by law that they cannot be sued. Yeah. So Pfizer has nothing to lose, and Bill has nothing to lose. He only has to gang depopulation agenda and money. He made tons of money off of the Pfizer vaccine.
So let me interject real quick. You when you started talking about Bill, you made me remember a key point So before COVID would drop, during the time, I think Alex Jones is the one to break the story. You know, he's usually the one that does it.
Oh, Alex Jones, stop listening right now. Oh, Alex Jones.
Look, bro, we done went how many minutes? 25 minutes. Not mention one thing about Alex Jones. All studies. But look, the SPARS pandemic 2025 to 2028. Y'all check that out.
Oh.
What people were reading this and then pulling up the tweets from the CDC, and they were exact replicas, exact follow-up.
Oh.
Like, for example, holiday travel plans, stop SARS by washing your hands and avoiding public places if you feel sick. If you feel ill, seek immediate medical attention. Use the vampire cough and avoid others to prevent the spread of SPARS. Practice good hygiene during your Thanksgiving travels. Bring home leftovers, not. So, this was, and then they just talk about the response. What's the plan? How to do this? How to do that? Social distancing. And this was planned before. This was planned before.
So when did this come out?
This came. I'm sorry.
Before COVID?
This came definitely before COVID.
Okay. That's all I need to know.
So we're gonna let me find the exact date on here. But my thing is this. They did this knowing what it would do to the economic world, the physical world, the mental capacity of everyone that's on this planet with no remorse.
Yep.
And they have received no punishment.
Nope. And the thing is, these companies, they cannot be sued, at least in the United States.
Yep.
They cannot be sued because they are protected by law. If something was to happen with these vaccines, they are protected by law. So Pfizer they don't care. So what if this vaccine doesn't work? So what if it kills millions of people?
Look,
We can't get sued. We just made a ton of money and we can't get sued. They're invincible.
Look, I want to say that the people that did this, they're on the level of Mao Zedong. They're on the level of Hitler. They're on the level of Genghis Khan.
Definitely.
Like, the crimes that they've done against humanity. We haven't even seen all the deaths yet. Because these people might die in 20 years for a turbo cancer or from stage 5 cancer they never had. But this is on the level of Hitler, Stalin, Mussolini. Mm-hmm. This is ridiculous. Mm-hmm. They have to be tried for crimes against humanity. All parties involved, especially Bill. He get on the stage with his pink sweater.
Yep.
You must get vaccinated.
You must get vaccinated to decrease the population of the planet. Blah 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 blah.
What? Who are you?
That's crazy.
Who
that
asked
is
for your
absolutely
opinion?
crazy.
Who asked for your opinion, Bill?
That is absolutely crazy. So, just one more time. Make it quick. The Bill Gates donate billions to vaccines, Pfizer, all these other vaccine companies, and he helped distribute the vaccine. He's also distributed the polio virus and vaccines and killed a lot of people in Africa when he was messing around with that years ago. Mm-hmm. He's talking about depopulation everywhere he goes. TED Talks, all this. He's talking about depopulation that via healthcare. He told you. He said, yeah, we need to get our population under control by making vaccines and controlling healthcare. That's what he said. Y'all just saw the clip. So, and he's making millions of dollars off this vaccine because he contributed to it, and he has ties with the WHO, World Health Organization. So, that's Bill for you.
Yep.
And then to keep in line with this depopulation tactic, let's talk about kids. Let's talk about women and fertility.
Right.
So, let's see. Conflicting advice on pregnancy safety. Early on, it wasn't tested in pregnant women, but government still encouraged it. They didn't think to test this on pregnant women or even think about if you're pregnant you shouldn't. I feel like every drug out there, not every drug, but a lot of drugs out there. Oh, don't take it if you're pregnant.
Yep, right on the back.
Right on the back. On all these commercials, reports of menstrual cycles, distribution, miscarriage, and fertility concerns post vaccination. And here's the thing. So, mRNA with these spike protein. You're talking about the spike proteins. So this mRNA vaccine puts spike proteins in your DNA. Your DNA now creates spike proteins.
Yep.
That's what it does.
Yep.
These spike proteins are found in ovaries and placentas, potentially impacting fertility. So you could be born if a pregnant woman took the vaccine. You could be born with
spike proteins already
with the mRNA already encoded in your DNA, and we don't even know what the mRNA could do yet.
We don't know for another 10, 15 years.
So Bill could really be playing chess right now and knew this, and he said, oh, when now these kids are going to grow up with mRNA in their DNA, and they weren't even around for the vaccine.
Right.
Then their kids will have the mRNA in their DNA. It's in your DNA. It is built into the blueprints that make you you.
Right.
Oh, let's take this for a 3.88 mortality rate. Let's have an experimental DNA link in our DNA. Every cell of your body now has this mRNA DNA inside of you.
Yeah,
for a 3.88 mortality rate.
Yep.
That's it. That sums it up right there.
Yep.
Would you do that? Why would you do that?
Make no sense. Mathematically, it doesn't make sense, and logically, it doesn't make sense.
Well, that makes, even if the governments of the world had the best intentions that's a question right there. We're gonna make this a short right here. Even please answer my question in the comments for any of you COVID vaccine believers and the government's looking out for us. Answer this question. If the government really wanted to help us out, why go with an experimental vaccine type mRNA? Mm-hmm. Why push that? Why not push a normal vaccine? Why not push a normal vaccine trials?
Or why not push the proven drugs that they now started giving to immigrants who had COVID?
Yep.
Like when they started crossing the border. Ivermectin, hydroxychloroquine. When Trump mentioned that, oh my gosh, he's not a doctor. But Bill Gates ain't a doctor either.
Nope. So why are the governments? They want to get rid of this epidemic. Why push an experimental vaccine? Why not just go with what we know? Why not experiment with the vaccine on something that doesn't matter?
I think this is a great segue to motives. Now now that we laid this out, we can look. Now let's look back. Now on the first episode that we did on the COVID series, the Bova series, we talked about the implications for kids, implications for the economy, and everything else. Now we're looking at the implications of health. So if we were playing chess, right, we would see that they just made 3 moves. They messed up the youth.
Yes.
They messed up the ability of older people to make more youth.
Yes.
They stifled the economy that we still never recover from.
Yes.
And they just completely messed up a whole generation of kids.
Whole generation. They
psychologically.
Psychology, yes. They also just potentially the rest of mankind
will have this mRNA.
They just infected the rest of mankind history. They just altered all of mankind's history.
Yep.
Think about that. Yep. This mRNA, it passes down. These blueprints are altered forever, and every single human after this shot was given out will have this altered DNA to them.
Yep. So let's say you didn't take the shot, right? And you procreate with someone who took the shot. There you are.
Your child will have an altered DNA.
There you are.
They're going to have GMO kids.
Yep. Might have a third eye.
GMO kids. Genetically, that's what they are. Next generation. How many do we know? Do we know a number of how many people took the vaccine? It was a good amount.
It was a lot.
I know a majority.
I
know majority. So amount. Majority of the humans have genetically modified DNA.
Yep. I mean, I got right here 19,140 COVID vaccine-related deaths. So that's just people who died. So just imagine how many people took it.
I know it's majority. I know majority took it because, again, not yelling at you people who are vaccinated. You are getting welded in your houses. You couldn't go outside in some countries. You couldn't do any of this unless you got vaccinated. I mean, you're cornered. You're almost cornered. It's either hold your ground or get vaccinated. So we have no issue with vaccinated people. This whole episode is a jab. It's a jab to the government and open up y'all's eyes. How bad the situation was. It's a vaccine. It didn't work. This is about effectiveness. That's a two-dimensional view on this. Now we are looking at what are the effects of this vaccine. People who took it will die. No. Every human after this event will have altered DNA and mRNA. Every generation after this.
Unless you find some woman, man, who wasn't vaccinated.
But even some 3 generations down, there's not going to be enough of them.
Right. So
it's just going to wean down. So, and you can't. Well, we don't have the technology now, but you can't take out links of DNA.
Right.
All this did was add links. That's a whole lot easier than taking out links. And you can't take out links of people who are already here. You would have to take out links of the human egg cell. And out of the human sperm cell.
Which is impossible.
As of now, impossible. But
impossible.
We might be dead by the time they do that.
So we wanted to come and present these facts to y'all. In summation, in conclusion, we have showed you that this vaccine was not safe nor effective, dangerous to people of all ages.
And the people who made it know this.
And the people who made it
they had a motive. We just covered multiple motives here.
And ignored all doctors, physicians, and people who actually did the studies. And now the human genome, the human DNA,
is tainted.
Is tainted and altered forever.
So, our first COVID-18 episode on Suppress Reality was called Tainted Blood.
Should we go Tainted Blood too?
Tainted DNA. This is way past blood. This is DNA.
Tainted generations. I like that.
Down to the DNA, the thing that makes you, is now tainted.
All because Mr. Billy Gates.
All right. That's all I have to say. Look.
Links will be in the description.
Links will be in the description.
Many studies.
Send this to people. Who send this, not even for views or no. Send this to people. We want to help everyone we can by opening up their eyes, because this could be round 1.
This. Look, they already talking about the what they call it, the bird flu and all this.
Bird flu. They got disease acts. They got all this. This is round 1. Do not be fooled again. You know, fool me once.
Same on me.
Shame on me. Fool me twice.
Come on, bro.
Do not be fooled.
Look, not everybody's all excited, got their guard down because Trump is in. No.
This is beyond Trump.
The opponent is plotting.
Yes.
Art of war. The opponent is plotting. Is waiting. Is want to strike. And we already know what they did first time Trump was president. They played the same bioweapon playbook. So I'm expecting it again. And this time, it might actually be a deadly bioweapon.
Yes.
Because what they failed to do with the COVID or the Bovid virus and the shot was to eliminate enough people. And so the people were, just as the Japanese said in World War II, that America was a sleeping giant. They awoke in the sleeping giant again. Because people were not paying attention. They, we just blindly trust the government. When people started to see their kids and grandparents and aunts and uncles die, that lit a fire in them. So now, anything they do, we on them. But that don't mean they won't try it again.
Yes. Yep.
That does not mean they won't try it again.
I think those are good remarks. Like, subscribe, comment. If you think we're wrong, go ahead, comment. I mean,
you can't really argue with the studies.
Look at this.
Look, hold on.
Bring that stack of paper right here.
1, 2, 3, 4,
5,
6,
7,
8. We're making it rain. Look at it, bro. This ain't no joke. Let me see that. This ain't no joke. This ain't no joke. So look, if y'all want to argue, look, we accept all comments, all criticism. If y'all want to argue with the comments, my challenge is first you read through these studies we presented, and then ask me a question, and then say something in the comments. Because we just laid it out. No one can say, the COVID shot was effective. No, nor was it safe.
Nope.
Nor was it safe. We thank y'all for watching. We are almost at 100 subscribers. We appreciate all the support. You know, we started this just as a way to get to our generation and speak our mind on certain issues, but we most definitely appreciate the support, and we're going to continue to drop great episodes for you guys.
Yep.
Yep.